Hello, welcome to APP2APP virtual lectures. My name is Alpha Jordan. I'm a practicing pediatric PA at the Center for Pediatric Medicine in Danbury, Connecticut. Today's presentation, we will be focusing on pediatric vaccine schedule. In today's objective, we are going to discuss vaccine preventable diseases, discuss vaccine schedule recommendation by the U.S. Advisory Committee on Immunization Practices, also known as the ACIP, for ages birth to 18 years of age, and also discuss vaccine schedule variations. I have no financial disclosure. So this table is a representation of the vaccines that a child from birth to 18 years of age would receive. So the first pathogens we are going to discuss is hepatitis B. Hepatitis B virus can lead to liver disease that can be spread through blood, semen, and other bodily fluids. And the hepatitis B virus is separated into 3 doses. The first dose is usually given at birth, so you can think of B for birth. And the second dose is given at month 1 or 2 after the first dose. And the third dose is given 8 weeks after dose 2 or 16 weeks from dose 1. So if someone develops severe anaphylaxis reaction after a previous dose or vaccine to the vaccine components such as neomycin or yeast, they should not be receiving the hepatitis B vaccine. A child must be at least 2 kilos or 4.41 pounds in order to receive the first dose of the hepatitis B vaccine. Another thing we have to look at is the mother's antigen status. So if the mother's antigen status is negative, which means that she was never infected with hepatitis B virus before, the child will receive 1 dose within 24 hours of birth if they meet the weight requirement or at 1 month of hospital discharge. Now, if the mother's antigen status is positive, which means that she was infected with the virus before, the child will receive hepatitis B vaccine and hepatitis B immunoglobulin 12 hours after birth in separate legs. And we will need to recheck, retest them again 9 to 12 months. If we do not know the mother's antigen status, we would administer the vaccine within 12 hours of birth. The next pathogen is the rotavirus. The rotavirus is a double-stranded RNA virus which can cause watery diarrhea, vomiting in infants and young children. The vaccine cannot be started after the age of 15 weeks, and the final dose cannot be given after the age of 8 months. There are 3 doses to the rotavirus, depending on which brand that you're using. The Rotavirus has only 2 doses. The Rototech has 3 doses. The first dose is given at age 2 months. The second dose is given at age 4 months. And the third dose is given at age 6 months. Again, if the patient develops severe anaphylaxis reaction from a previous dose or the vaccine component, and they should not be receiving the subsequent dosage of the vaccine. And also if they are severely immunocompromised, and also infants who have a history of intussusception should not receive that vaccine because it might increase their chances of developing intussusception again. The next pathogen is the Dtap. So this is actually 3 different bacteria that we will go through each one of them. The diphtheria is a bacterial infection caused by the Corynebacterium diphtheria. It is a highly contagious infection affecting the throat, nose, and skin. Complications of that bacterial infection can be heart failure, shortness of breath, paralysis, and death. The next bacteria is a Clostridium tetany, tetanus. That infection affects the nervous system, and risk factors include a wound or cuts exposed to manure or soil, foreign body in the wound, or infected lesion. So if somebody's get step on a nail or get cut by some rusted metal, they should be receiving the vaccine. Complications can be very painful muscle contractions, lockjaw, and death. The next pathogen is pertussis, and it's a bacterial infection caused by Bordetella pertussis. It's also known as the whooping cough. So the whooping cough is basically a violent, uncontrollable cough, making it difficult to breathe, and that can be very deadly for babies. So Dtap Vaccinations is a 5-dose series, but the Dtap is a group of potentially fatal bacteria that can affect your respiratory, cardiovascular, muscular system. And the first dose of the vaccine can be given at age 2 months, and the second dose is given at age 4 months, the third dose at age 6 months, and the fourth dose can be given between the age of 15 to 18 months, and the fifth dose can be given between the age of 4 to 5 years of age. Again, if the patient has a history of severe anaphylaxis reaction, they should not be receiving the vaccine. And after the vaccine, some patient may develop fever and or moderate to severe acute illness. And one should be very cautious if the patient have a history of epilepsy or seizures. The next pathogen, Haemophilus influenza type B, is a bacterial infection that can affect the ear, the brain, spinal cord, to severe bloodstream infections. There are 6 types of the Haemophilus influenza, but B is the most common. It goes from A through F, and today we go focus on just B. The vaccines are 4-dose vaccine. You can think of 2, 4, 6, 8. Who do we appreciate? To help you remember at the age that the child received it. But the 8 is not at the 8 months, but about 10 months from the first dose. But the first dose can be given at age 2 months, the second dose 4 months of age, the third dose 6 months of age, and the fourth dose can be given between the age of 12 to 18 months of age. Again, a child should not receive it if they have a previous reaction to it, and also should not be given to patients with latex allergy. So some of the common symptoms of the bacterial infections are fever, cough, shortness of breath, chest pain, fatigue, and headache. So this bacterial infection can be spread via respiratory droplets, such as coughing or sneezing. And those who are less than 5 years of age or more than 65 years of age are more at risk of getting that infection. And patients with the following conditions, such as sickle cell, asthenia, HIV, are also at risk for developing the bacterial infection. And this is typically diagnosed via labs or CSF, cerebrospinal fluid, and it can be treated with antibiotic. But the best way to prevent this bacterial infection is through hand washing, like for most pathogens, and also getting the vaccine. The next pathogen, the pneumococcal bacteria, is basically caused by Streptococcus pneumonia, can cause ear, sinus bacterial pneumonia, and other bloodstream infections. Now, there are different brands to this vaccine. Today, we only focus on PCV13 and PPSV23. There's also 15 and 20. So the PCV13 minimum age, you have to be at least 6 weeks, and PPSV23 is 2 years of age. So again, just like the previous vaccine, this one is a 4-dose vaccine. The first dose can be given at 2 months, second dose age 4 months, and the third dose 6 months of age. And the fourth dose can be given between the age of 12 to 15 months. But you cannot get the full dose before you turn 1. Contraindication, severe anaphylaxis reaction to previous vaccine or the vaccine component. So the next pathogen is the polio virus. The polio virus can cause life-threatening disease affecting the spinal cord and causing muscular weakness, paralysis, or death. So the polio vaccine we have right now, it's the injectable, but they also have the oral polio vaccine. So TOPV, which is the oral given before April 1st, 2016, can be counted towards a series. So if somebody had the oral polio vaccine, but now they're getting the injectable, that should count. So the first dose is given at age 2 months, the second dose at the age of 4 months, and the third dose can be given between the age of 6 to 18 months, and the fourth dose can be given at the age of 4 to 6 years of age. It must be at least 6 months from the previous dose. So we have to wait at least 6 months from the last dose. Again, this vaccine should not be given to anybody who has a previous reaction to the polio vaccine or to vaccine component, and or if they are pregnant. The influenza vaccine, vaccination. Again, the influenza is a viral infection that is common, can be deadly in certain groups. Yearly doses start at the age of 6 months. So the earliest one can receive the influenza vaccine, that's 6 months of age. And if the patient or the child did not receive 2 doses of that vaccine within 1 season, if they're between the age of 6 months and 8 years, then they would need to get a second dose at one point. So if at 1 year of age, they had 1 dose of the vaccine, the following year, they have to get the 1 dose, and then they have to get a second dose 28 days after that. Otherwise, they would need to, get it at some point before they turn 8. But after 8, it's only 1 dose they would have to receive. Again, if one has severe anaphylaxis reaction to a previous flu vaccine or the vaccine component, or if they have GBS, Guillain-Barré syndrome, after the first dose, severe allergy, they should not be receiving that vaccine. And also, this vaccine cannot be given for at least 28 days after a live vaccine has been administered, such as the MMR or the Varicellular. They can be given together, but they cannot be given a week apart or 2 weeks apart. They have to wait the full 28 days if they were not given together. The next pathogen is the Hepatitis A. It's a viral infection that can cause inflammation of the liver, and this is transmitted via fecal-oral route and mostly affect those caring for infants during diaper changes, such as caregivers or daycare. So that's why it's very important to receive those vaccines, especially if the child goes to daycare. So the Hepatitis A vaccine is given intramuscularly as a 2 or 3 dose, depending on the formulation. We have the VA-QTA and also the Havrix, HAVRIX. Again, this vaccine was first recommended in the US in 1996. It's a 2-series vaccine. The first dose is usually given at the age of 12 months. The second dose is given 6 months after the first dose. But it can be given to younger patients between the age of 6 and 11 months if they're going to travel internationally, but they will need to be vaccinated with 2 more doses upon return to the US. So the contraindication, again, is anaphylaxis reaction to a previous dose of the vaccine or the vaccine component, and also if they have any allergy to neomycin. So the next pathogen is measles, also known as rubiola. It's a viral infection. Some of the signs and symptoms of this bacterial infection, this viral infection include fever, cough, coryza, conjunctivitis, the conflict spot on the mucomucosa, which can be seen from this picture here, maculopapular rash, which can become confluent on this child on the right. And also the rash usually begins on the face and the head. And the vaccination began in 1963. The mumps, it's an acute viral illness, can be spread through salivary secretions. Complications include orchitis, inflammation of the testicles, peritonitis, inflammation of the peritonic gland, as can be seen with this child, mastitis, pancreatitis, and meningitis. This vaccination for mumps began in 1967. Rubella, which can be translated as little red, is also known as the German measles because it was first described as distinct clinical entity in Germany and has similar characteristics to the measles, So typically, you would see a faint maculopapular rash that begins on the face and progresses down to the body, and complications include miscarriage, stillbirth, premature delivery, blindness, deafness, and cognitive impairment. The vaccination for the rubella began in 1969. So within, from 1963, 67 to 69, these three vaccines basically came out in the market. So all these other, all three viruses, again, are combined for the vaccine. So you usually see as the MMR, measles, mumps, rubella. Sometimes they have the varicella as a combination, but today I'm going to focus on just the MMR, and then we're going to talk about the varicella separately. Again, it's composed of live virus. It's a 2-dose vaccine. Again, depending on where you work, at determining at what age you give it, but the first dose can be given as early as 12 months of age, to between 12 and 15 months. And the second dose can be given 4 to 6 years of age, but some places do it sooner than 4 years of age. The vaccine must be given at least 4 weeks apart to children who are catching up. If you have the MMR varicella combination, you have to wait at least 3 months between the interval. It can be given to younger patients, 6 months to 11 months. If they are going to travel internationally, the first dose will have to be repeated, just like the Hepatitis A vaccine. So at my practice, we usually give the first dose of the MMR varicella at 1 year, and then the second dose at 2 years of age. But some places wait until 4 years, or 5 years, or 6 years of age to give it. Again, if a child has severe anaphylaxis reaction to a previous dose of the vaccine or the vaccine component, or if one is pregnant or immunocompromised, should not be receiving the MMR vaccine. The next pathogen is varicella, also known as the chickenpox. It's a highly contagious virus, present as pruritic rash characterized by papules, vesicles, and crusted ovary lesions, which can last anywhere from 4 to 7 days. And this infection can reemerge as zoster or shingles later in life. Combination of the MMR and varicella vaccine can be administered to kids ages 1 to 6 years of age as a second dose. And so the varicella vaccine was first developed in 1974. It's a 2-dose vaccine. The first dose can be given at the age of 12 months, and second dose can be given as early as 2 years or 3 months after the first dose. Contraindications, pregnancies, severely immunocompromised, or receipt of specific antiviral drugs 24 hours before vaccination. Any type of drug should be avoided 14 days after vaccination. So if an individual had the flu infection and they want to take the Tamiflu, they would have to wait 14 days, which, we all know after 72 hours, the Tamiflu doesn't really do much for the virus. But you cannot, get the vaccine 24 hours, after you start with antiviral like that, or you have to wait at least 14 days before you can take any other antiviral medication. The next pathogen is basically a booster from what we talked about before. We talked about the Dtap, but this one here is a Tdap, tetanus, diphtheria, and pertussis. This vaccine, it protects against 3 different bacterial infection. The first dose is given at the age of 11 years. And then individual would receive a booster every 10 years. Special occasions where they would receive it before the 10 years would be if, one dose should be given in pregnancy during weeks 27 to 38 weeks. If they have a minor wound cut, administered to Tdap if more than, or TD if more than 5 years since the last dose of tetanus toxoid containing vaccine was given. And again, if they have severe anaphylaxis reaction or after a previous dose of vaccine component, they should not be receiving that vaccine. So the next pathogen is the meningococcal bacteria we're going to discuss. The meningococcal has several different serogroup. So the serogroup A, C, W, Y, you usually hear that vaccine as the menvio, menactral, or menquat-V. Again, it's a bacterial infection. It's a 2-dose vaccine for that bacteria. The first dose is given at the age of 11 years, and the second dose is usually given at the age of 16 years. And special occasion can be given earlier to immunocompromised individual with an anatomic or functional schizophrenia. They have a HIV infection or immunocompromised. Again, if they develop severe reaction after the previous dose or component to the vaccine and to a tetanus toxoid containing vaccine, they should not be receiving the meningitis vaccine. The next pathogen, the human papillomavirus. You would also hear this as known as the Varicellular. So the HPV is a viral infection causing certain type of cancer in warts. There are more than 100 different strains of the Hpv virus. The 2 strains that causes genital warts are 16 and 18, and the 7 strains that causes genital lesions are 6, 11, 13, 33, 45, 52, and 58. So the Hpv vaccine so back in 2007, they had the HPV2. So that the HPV2 only covered 2 different strains, and that was recommended only 2 females. And in 2012, we have the HPV9, which is recommended to males and females because it doesn't cover just against 2 different strains. It covers the 2 plus 7 more, so that's why they call it the 9. So it's 9 total, 9 different strains of the virus. Again, it's a 2 or 3-dose vaccine, depending on when the child received the vaccine. So the first dose is given at the age of 11 years, but it can be given as early as 9 years of age. If the first dose is given after the age of 15, the child would need to get 3 doses of the vaccine. If it's given if the first dose is given before 15 years of age, they would only get 2 doses of the vaccine. The second or the third dose of the vaccine will be given 6 to 12 months apart. Some special occasions at which they would receive the vaccine before the regular schedule will be, it can start early if they're immunocompromised or if they have a history of sexual abuse or assault. Contraindications, again, severe reaction to the vaccine previously or the component of the vaccine. So the second different type of meningococcal serogroup we are going to discuss is the serogroup B. You will also hear it as the vaccine as the Bacterial or the true member. Again, the meningococcal serogroup B, the meningococcal vaccine, it's a meningococcal bacterial infection. The vaccine has two dose series to it. It's a two-dose series. The first dose is given at the age of 16 years of age. The second dose is given 1 month apart if you are taking the Big Sarah, or 6 months apart if it is the Chumimba that you are receiving. Special occasions, again, can be given earlier if the patient is immunocompromised or with anatomic or functional dysplenia, HIV infection, etc. If they had a previous reaction to it, they should not be getting the vaccine. And one should be very careful if the patient is pregnant or has latex sensitivity. The next vaccine, we don't, the mainland US, we don't typically, see it, but it will be the dengue, which is a viral infection in certain endemic areas. They would receive that vaccine. It's a 3-dose vaccine. The first dose can be given as early as 9 years of age for those in the endemic areas. And they have to have a confirmed lab test of previous infection. So not only that they just give it to anyone, but you have to have the lab test show that you have a previous infection to it. The doses are given at 0, 6, and 12 months apart. Endemic areas such as Puerto Rico, American Samoa, U.S. Virgin Islands, Federal State of Micronesia, Republic of Marshall Islands, and Republic of Palau. Those are the places that are considered to be endemic for this type of viral infection. Again, contraindication would be severe anaphylaxis reaction to a previous dose of the vaccine, or if patient is severely immunocompromised, they should not be receiving the dengue vaccine. So a lot of parents are concerned about getting their kids vaccinated. Some of the most common concerns I hear from parents are the vaccines are painful, which is understandable because poking the child. I don't think anybody likes to be poked. But it typically, once the child gets the vaccine, most of the time they don't have any pain after they leave the office. Certain vaccines, such as the tetanus, usually get sore arm for a couple of days, and also you can get redness at the site of injections. Sometimes you can get swelling, but usually goes down after a while. Some parents are also, concerned that, there's not enough research on those vaccines. Most of the vaccines we talk about, they've been around for a while. And a lot of the infections that are caused by those bacterial viruses are actually, not really present in the US anymore because of those vaccines. So, and the other concern is a vaccine will cause the disease or other defects. There's been rumors going around about some vaccine causing certain type of diseases. Those are research were not true, and I always tell the parents that most of those vaccines are not live, so they're not going to cause the disease. I was providing with research, literature to and also I usually advise the parents to do their own research as well if they are very concerned. So basically, this is it, and I thank you for having me to do this lecture. I hope that you all receive some information that you can use towards your practice of medicine. And it was a pleasure doing this lecture. Thank you.